All right, everyone, we will officially kick things off here for our latest webinar. And this one really is building on the webinar from last month, where we had Dr. Navaz on the webinar, who really broke down the science of the vagus nerve and how that pertains to heart rate variability. And we had a tremendous turnout for that webinar. Dr. Navaz provided some amazing content. So if you missed that, it's available on our website, or we can send you a copy of the recording. But there was so much interest in the topic that we wanted to follow it on with another expert from our network, Mr. Don Moxley. So today we're going to take a deep dive into heart rate variability, very specifically looking at how we can start to utilize heart rate variability in clinical practice. This is an emerging and incredibly powerful biomarker. And one of the beautiful things about said biomarker is we don't have to wait 6 or 12 months to get lab draws to look at it. We get consistent, high grade, high quality measurements every single day, which opens up new possibilities in how we understand stress, how we understand how well a protocol is working, or a medication is working, or a behavior modification is working. So it really is an easy to collect daily biomarker that gives us a really good indication of overall system health. We're starting to see more and more heads up customers start to implement HRV in clinical practice, and we really want to dive in and understand this powerful metric in more detail. So without further ado, a little bit about our agenda here today. We'll start with some quick introductions, and then I'm going to turn it over to Don for the feature presentation. And Don's going to break down the science behind HRV, clinical applications, using HRV for performance optimization, integrating into practice using heads up, proven protocols. There's demos of how this works in clinical practice throughout the webinar. So it's not just a breakdown of what HRV is. That's great. But if I'm a clinician and I want to implement this in the practice today, I need a way to capture this data from my clients or patients, and I need a system that allows me to review it all. So we're also going to talk about not just what is it, but how do I actually operationalize this in practice today with current technology? And then we'll have time at the end for monitoring any questions from the chat that we couldn't get to. We'll do our giveaways. And then we want to hear from you on what webinars you want us to tackle next. So we've got some questions about where you'd like to see some of our future direction in terms of our webinar presentations. So I'd like to introduce Mr. Don Moxley. And Don, I remember this was years ago. I think I may have had you on the podcast, and you made a comment that stuck with me, Don. You said, when I was coaching wrestling at, I think it was Ohio State, wherever college you were working at, you said, I could predict with a very high degree of confidence whether my wrestling team was going to win or not based on the HRV scores of the athletes. And so you were able to look at the individual scores, look at that as an average across the whole team relative to their baseline and relative to other events, and with a high degree of accuracy predict an outcome. So just gives you an indication of what's possible when you know how to use this information in practice. And I thought it was just a really great example of what's possible with HRV in terms of health optimization. So we're grateful to have you with us here today, Don. You're a very articulate speaker and a fantastic educator and extremely knowledgeable on this topic. So big gratitude for Don for taking the time to prepare this content today. So aside from that, Don, it'd be great if you could give us a bit more on your background, how you got into this field, and anything else you want to share just in terms of your expertise on this topic.
So with that wonderful introduction, I have to be careful not to pick my nose while we're doing this and kind of blow the whole thing, right?
You can do whatever you want, bro.
So I'm really excited to be here and have the opportunity to speak to your audience. It's a great audience. I've worked with you guys on a couple projects in the past. To give you a little bit about my background, I'm trained as an exercise physiologist. I did my graduate work at Ohio State back in the mid 80s. And I've been a professor of the exercise sciences for about 27 of the last 35 years. I've always had a foot in the classroom, while I've also had a foot in the industry. I had the opportunity to go work with the team from Polar Electro nearly 25 years ago. Learned a ton. I'll talk a little bit about that in the presentation because that was my introduction to HRV. That was with Polar and some of their products. And this is pre-smartphone kind of products, but it's been part of what I do for the last 25 years. And we'll walk through it and try and paint a vision for what we be able to do with it in the future, because I think that's the real value proposition.
Awesome. Thanks, Don. Dr. Limansky, quick intro for the audience.
Yeah, thanks, Dave, and thanks, Don, for joining us. So I'm John Limansky. I'm the Chief Medical Officer with Heads Up. By way of background, I'm board certified in internal medicine, and I run a longevity practice in the Northeast. I use HRV quite a bit with my patients, but I'm always eager to learn more. So really excited to hear what Don has in store for us. So thanks again for joining us, and I'll leave it out to you.
Thanks, John. And I'm Dave Korsunsky. I'm the founder, CEO here at Heads Up. Heads Up is a data platform. It's meant to pull together all of the fragmented mess of data out there that has key insights into people's health, blood tests, medical records, sensors, wearables, PDF files, Excel files. We stitch it all together and we provide one beautiful, seamless interface for precision medicine, longevity, integrative functional. So how do we get the data organized and use it for better decision making? HRV is one of many biomarkers that we offer in terms of clinical practice. We'll go deeper into how we do that today, exactly how you operationalize it. But speaking personally on this topic as a business owner, as an entrepreneur, that is the one number I look at every single morning above all else. That tells me how well I'm managing my rest, my recovery, my stress, my resilience. When I'm traveling on the road for 3 back-to-back shows, I can see how I'm starting to get run down. When I'm back home and I'm recharging, I know exactly when I'm back to baseline. So of every data point I look at personally, professionally, for me to show up as the best version of myself every single day, that's the one number that I calibrate towards. So that's how I use it personally. We'll get into more examples of how that's used, but that's why I was so passionate about bringing this webinar together here today. And then our Q&A experts are Mr. Chuck Hazard. Chuck's an expert on all things sensors and wearables. He's our internal subject matter expert on Oura Ring, Garmin, all the devices we integrate. He's our expert and spent many, many years working directly at Oura and has in-depth expertise on their product. And Aaron is our head of sales. He's also a biohacker and lives and dies on these numbers just as much as the rest of us. So fire any questions to Aaron and Chuck. I'll be bubbling some of them up as we go through the discussion here today. But they're in the chat and ready to answer any questions on anything we're speaking towards today. We always like to give away some prizes just from some of the cool companies out there that are on our radar screen. We don't have affiliate relationships with any of these companies. We just love their products and we like to give away stuff. So we've got an Oura Ring up for grabs. We've got some of our preferred curcumin product up for grabs. We've got some Delta G, our favorite ketones. Been slamming those before the webinar. And then we've got the True Diagnostic Biological Age Kit. So just ask some great questions, have some fun in the chat, and we'll select some prize winners at the end of the webinar. So with that, we wanted to just start off with our first polling question. And it's an easy one. We're going to start off with a little softball here. So I will bring up polling question number 1, which is, are you currently tracking HRV with patients in your practice today? So overwhelmingly, yes and no, but I'd like to. I'll leave that out there for another minute or two. I'm actually going to stop the share now, Don. And
Okay.
I believe as a co-host, you should be able to share your screen. So I'm going to turn it over to you, my good man, for the feature presentation.
What are you seeing?
We see your slides. I see your slides. Can someone on the
Okay.
webinar as an attendee let us know? Are they seeing Don's slides?
Do you see a big
Yeah.
red heart?
Yeah,
Yeah,
we got you, Don. Coming in,
everybody's.
Chris.
Okay. Um, Okay, we're going to go ahead and get started rolling here. Thanks again for the for your time and spending it with us today. But we're going to roll through understanding heart rate variability, and I'm going to be looking at this more from a 30,000-foot view rather than a very technical view of HRV. We're going to be looking at it at a higher level view as to the why. Why is this something that you want to have either in your practice or in your practice as a medical provider or in your practice as a sport performance supporter? You know, we've got a trainer on here, we've got other people on here, exercise scientists, sport coaches. So we want to look at it because this is one of those unique variables that reaches across the spectrum. So in the presentation today, we're going to make a case for a universal health and performance marker. And I think that's really important. That's the important value prop for HRV. We're also going to take a look. We're going to review HRV and the autonomic nervous system and autonomic function, which is critical. We're going to talk about how to measure and monitor HRV. And then finally, we're going to wrap up with some examples of how you can integrate this into your practice. Again, either as a medical professional where you're dealing with symptoms and illness, or as a performance professional. And again, whether it's sport or you've got a Wall Street client or something like that, these factors will go across the spectrum. So as we start, I like to think about a model. And I've thought about this one for a long time, and the fact that in 1998, Dr. Martin Seligman addressed the American Psychological Association and initiated the concept of positive psychology, shifting the focus from merely alleviating symptoms of mental illness to promoting higher levels of well-being. And this new paradigm champions the concept of thriving and optimal human functioning, motivating individuals to reach their fullest potential. And when we look at this, I like to, when we think of medicine, a lot of times we think of our health from 0 to -10. You know, if we're asymptomatic, if we don't have anything going in our lives that we're worried about, we're probably not interfacing with our medical professionals. But then we get symptoms, things happen, and we eventually work our way down to -10. If you go below -10, you're dead. And this is what Seligman said. He said, we're really good at helping people go from -10 to 0. He says, why aren't we helping people go from 0 to 10? And I think that's a great model for what we're talking about. So that's what this looks like here. And again, the 0 to 100 on the right-hand side is simply it's speculative. I don't know that that's the range. In fact, the range changes for most people, but it's the concept. We want to move away from 0 and towards 100, and that's what we're going to be working on as we work our way through the presentation. When we look at patient ownership of health, modern practitioners encourage patients to embrace ownership of their health, emphasizing personal responsibility for achieving this optimal well-being. This approach fosters active engagement in health decisions, moving from merely being symptom-free to thriving and maximizing daily performances. So the conventional view of a patient is often limited to those seeking medical care for illness or symptoms. Instead, the broader definition, as we start to look at the model, starts to encompass individuals actively pursuing health optimization, illustrating the shift in focus towards wellness and proactive health management. There is a significant number of health seekers out there who want to thrive. I rarely go a week without someone asking me, hey, I want to work with a doctor that works at optimization. And I'm making references for these people at that time across the country. So this is the demand that's out there that people are looking for. Our challenge is that as practitioners, is what is the objective data that we use for patients who are taking ownership of their own health. We've been trained in the SOAP notes concept, subjective, objective. We do an assessment, we do a plan. Well, as a sports scientist, this is the same process I follow. We do a subjective analysis. Can this person put up with the work that we think they need to do? Do I have objective data to back up that subjective evaluation? I create an assessment, and those assessments, whether they're at a patient level or a performer level, those assessments are darn near always individualized. And then finally, we put together the plan to help that person achieve their goal. So again, we go back to the questions: what is the objective data that we can use? And is there a data point that will reach across the spectrum from illness to performance? Well, I think that's what we're talking about here. Heart rate variability represents a biomarker for health status and overall stress response, offering insights into physical and emotional resilience. And we'll use this term several times, resilience. This is a new factor we're using in sport performance. It's not just strength and speed and endurance, but resilience winds up being a very important term. When we look at HRV, it's increasingly recognized as a crucial tool in assessing health, predicting outcomes, and guiding treatment strategies. By monitoring HRV, healthcare providers can gain valuable insights into a patient's or a health seeker's overall well-being and stress management capabilities, enabling that personalized medical intervention process. I'm proud to say, so I'm going to reference about 20 different papers in this presentation. This is the first one. And I'm proud to say that this first paper I'm referencing was co-authored by one of my former teammates at Ohio State. I wrestled at Ohio State back in the early 80s. I had a teammate there, Dr. Raouf Rangarbo. Later in the presentation, I'll talk about my experiences with the application of HRV monitoring in elite college athletics. Ron was critical to our success in that program. He's a pain management doc out on the East Coast now and does a wonderful job integrating HRV into his practice. But in this narrative review, it presents the current state of HRV literature through different medical specialties, delineating the application of HRV into specialties aids in the organization of the review. The authors state in the paper that HRV demands we break free of the systems-based approach and instead begin to utilize a whole body approach to healthcare. With the proliferation of wearable technology and medical equipment that can measure interbeat intervals, that we call this IBI, HRV can be a non-invasive, easy to use, and cost-effective metric for clinical application in both inpatient and outpatient settings. And I would argue at a sport performance level, I was on a call 2 weeks ago with a coach from a Big Ten school, a Big Ten school, and my recommendation is that when your team comes in, there should be an Oura ring or something equivalent on the finger of every one of those athletes so you can start the data collection process. We'll talk more about it at the end, but this is how much I believe in that. I don't know that we dig that far into it, but we'll look at this just a little bit.
You want to take a couple questions, Don?
Sure, if you've got some good ones.
I got a good one. Is there a correlation between hypertension and HRV?
Is there a correlation between hypertension? Yes. The direction, I don't know that we know completely right now, particularly when you take a look at Dr. Habib's work at upgrading the vagal nerve. Yes, there's absolutely going to be a relationship there. And when you look at HRV with any of your organ systems, if you have any organ system that is out of function, that is low performing, that the body is going to say that's a stress response. It's going to give you a sympathetic kick and it's going to lower your HRV. So I think the answer to that question is yes.
Doc, anything you want to add to that?
Yeah, I mean, I would agree with that. So again, I don't know if there's a ton of research looking directly, but just intuitively, what Don said is accurate.
What about VO2 max and HRV?
Yeah, there's an interesting relationship with VO2. We can actually, when we were at Polar, we had actually had some data that was giving us the ability to calculate VO2 max using HRV status and heart rate. So yes, there are relations. Listen, HRV is an indication of vagal tone. We're going to spend a little bit more time talking about it here. And anytime that you have an improvement in vagal tone, you have an improvement in that vagus nerve's ability to shift from some sympathetic to parasympathetic, you're going to have, it means more resources, it means more resilience. So yes, you're going to have an improved response there.
Awesome. Back to you, Don.
But if you have a high HRV and a lion walks through the door, you're going to have a low HRV until you get away from the lion. So don't ever forget that. I think, yeah, we took care of this slide. Let's go ahead and move on a little bit. Athletes are beginning to use HRV metrics to optimize training and recovery protocols. HRV and analytics can indicate readiness for performance, helping coaches tailor programs based on the athlete's physiological status and stress levels, thus enhancing performance and reducing injury risk. The next 5 slides are slides that I pulled from my work that I was doing at Ohio State back 15 through 18. The first slide here, this is how I started working with this team, is that I got a call from the coach on, I think it was February 7th. They had just finished wrestling a match that weekend. They had an athlete that was struggling. Now, and to put this in perspective, Ohio State that year, this is 2015, they had a wrestler who had won 3 national titles, was coming back to win their 4th. There had only been 4 wrestlers to the point that actually done that. They had a freshman class of 3 freshmen that went on to become 4-time All-Americans. One was an Olympic gold medalist. One was a national champion. They were all 4-time All-Americans. So they had a lot of great, they had a really good point scoring team showing up for nationals that year. But to win a national title in wrestling, you need 5 or 6 point scores, really minimum. So we had a kid on the team. His name was Kenny Courts. Kenny was a very talented 3-time Pennsylvania state champion, which is very difficult to do. But Kenny was way underperforming. So the coach calls me and says, "Hey, can you work this guy up?" And he brings him over to my place, and I strap him up at 9 o'clock on a Sunday morning, 48 hours, a solid 36 hours after he had wrestled a dual meet. His resting. This was an SDNN. We'll talk a little bit about it, but his resting HRV was 10 milliseconds, which is very low. I had the athlete go lay down in my facility, lays down for 5 minutes. HRV climbs to 100 milliseconds. As soon as he stands up, it drops back down to 10. So,
Wow.
so Kenny's body at that time was recognizing the act of standing up as a full stress event, a full stress response. If you're sitting in a room and, like I said, a lion walks through the door, your HRV drops to about 10 milliseconds. It signals your stress hormones to release. So you get the cortisol, you get the adrenaline, the noradrenaline, you get all that out into your system so you have the resources to escape the lion. Well, this is his body was interpreting that, and the coach said to me, and he could only do about half the work that he needed to do on the erg test we did. And I said, "Listen, your athlete is maladapting to his training." I don't use the term overtraining anymore. He was maladapting. So you're either positively adapting or you're maladapting. Coach said, "What do you do?" I said, "We got to get some training controls on this guy." So the technology that I had at that time was not enough that I could use it in the wrestling room. It took until about the 18th or 19th of the month for me to get a Omega Wave system in. It was the brand new Omega Wave system. I think I got the second device that was in this country. And you'll see that out there on the 20th, it's still pretty low. And so for the rest of the month of February, leading up until where you see Big Tens there, the only thing I did with Kenny was throw training controls in. You'll see where we're getting that nice little climb at the end of the month. That's just me going into the room, wiring him up. And as soon as his heart rate hit 165, which I calculated to be his anaerobic threshold, I pulled him out of practice. Now, the coaches looked at me like I had 3 eyes. This is a great coaching staff. They eventually coached a national championship team. They knew what it took. But the problem is Kenny was not adapting. He was maladapting. We threw the controls on him, and you'll see that we get him up to a little over, I think it was 78 or 79 milliseconds. He had to do a weight cut going into Big Ten. So that's the reason you see the drop there down into the 50s. But he got to Big Tens, and he qualified for nationals, and that was the big thing we were going for. Now the thing he only had to win 2 matches to qualify. So I think he was 2-3 in the Big Ten that year. But the 2 wins, he had to score 8 points twice. And this kid had not scored 8 points in the entire year that year, 2015, leading up to that. So it was good sign. So we qualified him. Then what you see after Big Tens, we started deliberate work focusing on cardiovascular fitness, training at threshold. And you'll see we eventually got that point. We got that pop one day where we're up above 100 milliseconds. And I'm thinking, good, we cracked it. His body is no longer recognizing work as distress. It's seeing it as a eustress. And this was really important. So we sent Kenny to the national tournament that year. I think the day before we sent him, his HRV was 78, 79. I was really happy with that. At the time, I didn't know the significance of that number, but Kenny goes to nationals. He makes All-American, finishes 5th in the country, and all of a sudden, a coaching staff that was looking at me cross-eyed thinking, what in the hell are you doing, are asking me, okay, what is this voodoo you have, and how do we do more of it? So we started working with the team a little bit more, and Dr. Garbo, who I was talking about earlier, bought me a First Beat bodyguard and First Beat software, and we started to do 24 and 48-hour studies of the team, getting deeper data sets. What you see in this graph are the how many is that? That's 7 wrestlers. These are 7 wrestlers in the starting lineup that would let me do the assessment. At this point, I'm still kind of the weirdo in the room. Not all the guys on the team gave me access. But what you see is that from the 129 to the 92, those wrestlers were all Americans. The wrestler with 45 and 15 did not make All-Americans. So this was my first indication that, resiliency and recovery contributes to performance. Now, when we figured that out, now I can start coaching resiliency. I can start coaching recovery. This is a 12-hour study. And when you look at the sleep pattern up here, you see a nice sleep pattern. They're going to bed. This athlete slept for about 7 hours that night, and you see good restorative parasympathetic response in that time. Now, at the same time, I had a wrestler that we did this study on, and I'm like, wow, what is going on here? Well, when I sat him down and had a heart-to-heart, he'd had 4 beers before he went to bed. So this was the first indication that alcohol could have a negative impact on recovery as measured through HRV. So now I had evidence where I could sit down with my athletes and say, your behaviors outside of the room matter. I know you can probably go out and drink, and trust me, I get it. When I was an athlete, we went hard and fast, okay? And just because you can complete a practice doesn't mean you'll get a benefit from it. So in this case, so this was some of the first evidence that we had that we needed to start to, and again, this is another Dr. Garbo term, intentional recovery. The same way we intentional taught
I love
skills.
that term.
I do too. Skills, cardiovascular strength, we had to be intentional in our recovery. So we take this one more year, and this is the morning HRVs. In 2018, we qualified the entire starting lineup for the national tournament, first time in school history. We had 8 All-Americans, first most ever in school history. But if you look at a graph of the HRVs the morning of the first day of the tournament, you remember I talked about that 70, 75 threshold? We see that I believe this athlete was 68, 67, 68. This guy was down in his 50s. Those 2 did not make All-American that year. The other 8 did. So now we're really starting to come up with some data. And for my audience, this is what's so important about this. You can't go get a book that says, oh, you send someone to nationals with an HRV of 82 and they'll make All-American. Now, there's a lot of other things that need to be there, and your populations differ and your stresses differ. It's critical that you build your own data sets. It's critical that you begin to aggregate your own systems, and we'll talk more about this in the presentation. But this was a huge find for me. That again, when I do the data, then I sit back and watch the tournament, and I'm like, okay, we coached recovery pretty well here. Now, we did not win a title that year. We were second again that year, but it was one of the best NCAA tournaments ever. So as we move through this, so
let's bubble this up, Don, because what you're talking about here, this athlete use case, this is really getting to the crux of the issue. Now, how do we start to take it out of the athlete domain where it's still very relevant? And now that we have easy ways for practitioners to collect this on individuals in the wild in real time, can we extrapolate some of these same concepts? And I can see some of the questions that are coming in the chat. They're starting to ask some of these types of topics, like, are there certain medications that may affect HRV? Dr. Navaz showed GLP-1 medication on the last webinar. Benzos, can that affect HRV? So now you can start to look for cause and effect with other interventions that can be a very helpful diagnostic. So I'm assuming that's where you're going now and starting to bubble it up to more general practice.
But I want to address that as a practitioner. The number one driver, the number one medical decision that affects HRV is typically in the blood pressure realm. And what I have found, and Dr. John, you can weigh in on this, anything that's a beta blocker or a calcium channel blocker just jacks your HRV. It absolutely wipes it out. If you need to do blood pressure medication, I'm a huge advocate of ACE inhibitors. It lets your heart function as normal. Plus, you get to control the blood pressure, and you get a little bump in HRV. Would you agree with that, Dr. John?
Yeah, absolutely. Anything that's going to slow down the heart, is going to impact the HRV. So I've seen, I would say even within beta blockers, different ones will have significant impacts. Things like propranolol tend to really crush HRV quite a bit. So it's kind of counterintuitive because the heart rate's slowing, but the HRV actually is going down too. So you have to be careful. And then you also have to look at sometimes their electrolyte status. Sorry, I'm in the city, because that can also impact the HRV in conjunction with the blood pressure medication.
Sure. So the answer to that question, Dave, is yes, it will impact it. You've got to ask these questions. I'll tell you, I've had physicians in exercising on my equipment in a facility I'm running and can't understand why their heart rate won't go over 135 beats a minute. And they are laboring and going hard. And I'm like, do you take blood pressure medication? And they look at me with this stunned look at that point. I'm like, you might want to switch from your beta blocker to an ACE inhibitor, but you're the physician. You make that call. So, okay. So moving on, our challenge is in the interpretation of HRV measurements. It requires understanding of normative values for your populations and their implications for health and performance outcomes. Obviously, different patient populations have different medications, different symptomology, things like that. So this isn't like, oh, blood pressure needs to be 120 over 80. Is that the recommendation right now? I really don't know. But that's not the way HRV works. We'll talk more about that in a little bit. In clinical settings, lower HRV is associated with morbidity and mortality, while higher values correlate with better performance and adaptability in athletes, in professionals, highlighting the necessity of specialized norms for different population. We're going to talk more about that as we go. This is not a one-size-fits-all in the analysis. HRV is increasingly recognized as a valuable biomarker for assessing altered autonomic function in both health and psychiatric disease. And I can't emphasize enough the value of HRV in psychiatric practices. The autonomic
We've had several questions on that come up, by the way, Don. Several questions around trauma, PTSD, mental health already in the chat on this topic.
I'll talk about that a little bit later in the presentation. Great question, by the way. The autonomic nervous system plays a critical role in regulating tissue and organ function, which is essential for optimal stress reactivity and adaptive response. The central autonomic network fine-tunes the central ANS activity, while the sympathetic, and parasympathetic nervous systems manage peripheral activity. In the context of disease, an imbalance in autonomic function is linked to reduced adaptability and increased health risk, including morbidity and mortality. You're going to hear this theme a lot throughout the presentation. In this 2002 review article, the authors focus on the role of autonomic nervous system in regulating HRV and examines the impact of different factors on HRV. Sympathetic and parasympathetic systems interact to influence HRV, with low HRV being associated with higher mortality rates among adults, making it a critical marker for the assessing of cardiac risk and finding that in the state of the autonomic nervous system. A well-functioning cardiac system is essential for healthy life, with the neurocardio system playing a pivotal role. Various factors, including pathological, physiological, psychological, environmental, lifestyle, and genetic factors, all influence HRV. And this is important. This is not a single factor piece. There are multiple vectors here that have to be accounted for. In this 2023 meta-analysis of the 17 articles, and it's fun to, I like the title of this paper, A Systematic Review of Heart Rate Variability as a Measure of Stress in Medical Professionals. So all the docs on here, this one's for you. In out of 17 articles reviewed, 11 demonstrated statistically significant changes in HRV metrics when healthcare providers were exposed to stressors such as medical simulations, procedures, or real emergencies. The review identified predictable trends in various HRV metrics associated with stress, indicating that HRV can serve as a reliable physiological marker of stress. The paper discusses the autonomic nervous system's role in regulating heart rate in HRV, emphasizing the balance between sympathetic and parasympathetic influences during the stress. The authors advocate for the integration of HRV monitoring simulations and training of medical personnel, suggesting that it could enhance the understanding of stress physiology and improve training outcomes. The review concludes that HRV is a valid and useful tool for measuring stress in medical professionals, offering insights into their physiological response during high-pressure situations, and this research could inform the training protocols and stress management strategies in a medical setting. Now, it's important, whether you're a licensed physician in practice or you're an athlete, we're all humans, we're all reacting to stress, we all want to have an optimum performance. HRV just happens to be a tool that crosses from -10 to +10. In this 2023 paper, HRV as a non-invasive method to evaluate autonomic nervous system modulation and is linked to cardiovascular risk. Increased HRV is associated with positive health outcomes, while decreased HRV indicates stress or illness. The paper review advances in technology, including wearable devices that facilitate HRV monitoring for early detection of cardiovascular issues. Now, while I'm not a licensed physician, I do have access to Dr. Google. And I went in and I used Dr. Google to tell me what the symptoms of cardiovascular disease are. Chest pain, discomfort, shortness of breath, swelling in the feet and legs, fatigue, dizziness, and fainting. Okay, I get it. But how about if we have an indicator that we can depend on that comes in long before we get to chest pain? Long before we get there, we now have a tool that we can start to do assessments and look at, and it gives us the ability to get ahead of the disease and really move people from a disease state into a performance state. In this paper, heart rate variability and first cardiovascular event in populations without known cardiovascular disease explores the role of HRV monitoring in the prevention of severe cardiovascular events, particularly highlighting its significance as a non-invasive biomarker for the assessment of cardiac risk. Increased HRVs associated with positive health outcomes, while decreased HRV signals stress or illness. You're going to hear that. I think that's the fifth time I've said it in the presentation. I think I probably got four more examples of that. But the paper discusses the evolution of HRV monitoring technologies, including the use of photoplasmography. I'll talk more about that in a minute if that's a new word for you, and wearable devices like smartwatches, making HRV assessment more accessible for pre-hospital self-monitoring. Regular HRV monitoring can serve as an important tool in identifying cardiovascular risk and managing conditions such as hypertension, mental health disorders, and frailty in elderly populations. In this paper, the authors suggest that integrating HRV monitoring into routine health assessments can reduce the burden on the healthcare system by enabling early detection of potential cardiovascular issues. The paper advocates for HRV monitoring as a proactive approach to health, particularly for high-risk groups, and highlights its potential role in telemedicine for patients with mobility issues and neurocognitive disorders. The findings suggest that HRV monitoring is not only beneficial for individual health management, but can also play a significant role in public health strategies aimed at reducing cardiovascular morbidity and mortality. The authors called for further research and broader implementation of HRV monitoring technologies to enhance the preventive health care. The paper contributes valuable insights into the application of HRV monitoring as a preventive measure in cardiovascular health, advocating for its integration into everyday health practices. Looking at personalized medicine approach in this paper, real-time personalized medicine through wearable sensors and dynamic predictive modeling, it presents a forward-looking perspective on how wearable technology and predictive modeling could transform clinical medicine by making it more responsive and tailored to individual patient needs. So essentially what they're talking about, think about your data coming from your Oura Ring or whatever device you're wearing, rolling into a platform, AI rolling on top of that, giving the physician a new tool for identifying problems ahead of time, but also motivating the patient as we move from 0 to 10, instead of messing with the negative values, to go ahead and take ownership for what we're doing. It emphasizes the importance of personalized medical care through real-time data collection from wearable devices, which can monitor various health metrics. Performance monitoring, HRV, is a valuable metric for monitoring athletes' performance, recovery, and training status, emphasizing the potential to inform training adjustments. Changes in HRV can indicate fatigue, overtraining, maladaptation, or other health issues, making it a useful diagnostic tool in sports medicine. I think if you've done any work with HRV monitoring, you've seen the fact that a lot of our wearable devices can warn us you're going to get ill. I distinctly remember in 2017, when you travel a college wrestling team, you have 10 starters, you can travel 6 more athletes with that for warm-up, for workout partners and things like that. As we were making the choice for the extra 6, I said to the coaching staff, we need to take an extra 150 pounder, which we normally didn't travel that weight. And they said, why? I said, well, this morning his HRV crashed, his body temperature was up, his respiration was up. This athlete was showing symptoms that were going to be truly symptomatic in about 24 to 48 hours. We traveled, wrestled Friday night. By Saturday, it was fully symptomatic with the flu, stayed in the hotel. We had to wrestle the other 150 pounder that day, and it gave us the data that we needed to make that call.
Awesome, Don. You know, we've had a few questions in the chat about identifying overtraining, and overtraining can mean an athlete who's overtraining. Overtraining could mean someone in their professional work life who's burning it too hard, traveling on the road too much, not getting the proper rest and recovery. So for me personally, like identifying overtraining myself, that's one of the most predictive ways I use it personally. So any comments just on how you would
Yeah,
use this as a detector of burnout or of overtraining?
as I said earlier, I don't believe in overtraining. I believe in
Okay,
maladaption, adaption. Okay,
gotcha.
so and now when I first started looking at HRV, when I was using the Polar products 25 years ago, it what I found was I would go work a trade show in Las Vegas, which meant there was a lot of late night dinners, there was a lot of alcohol, there was poor sleep, and you do it for a week. When I left for that trip, I would have resting HRVs in the 60s and 70s back then. I would
Yep,
get back from that trip, I'd be between 10 and 15.
yep,
I took 2 days
exactly.
off, or I do what I would do is just warm up kind of work. I would do zone one, zone two kind of work, give myself 2 days of that. I'm in the 40s. I could step into more deliberate workouts after that, and I would start to things move from 40s up to 60s. So it's going to contribute to the decision making process. That's where it really becomes valuable. Now, I do not advocate for waking up in the morning, looking at your wrist and saying, okay, what am I going to do today? This is a whole nother presentation, but I'm an advocate for setting a goal out on the horizon, developing a training plan for that goal, and then using HRV as a secondary indicator. Am I moving towards my training plan? Am I moving towards my goal? And if I see a significant deviation from adaptation to maladaptation, I have to go in and change my plan.
Yep.
This is where it becomes very valuable. There's 2 papers in the bibliography of this presentation that you all can have access to. Um, where they took a look at just comparing a traditional training program, I think this was marathon training, to an HRV directed training program. And the data is very clear. HRV training improves outcomes. When you're making those decisions, it improves outcomes. So, and I think one of the other things I want to lay in here, Dave, is that when we look at the practical application of HRV monitoring and training regimens, pre-competition assessments, recovery strategies, and providing guidelines for athletes and coaches, it aggravates me to no end when I see an athlete injured and the medical staff said, oh, it's just bad luck. I do not accept that. I personally believe that when an athlete and teams are equipped with wearable tech, we are able to see the adaptation, maladaptation cycle, and we are going to be able to predict injury. You know, I have a daughter that coaches Division 1 lacrosse at this point, and one of the challenges with female lacrosse is one of the challenges is with ACL injuries in these female athletes. There is no doubt in my mind when you put an aura ring on the finger of all those girls and you start to aggregate the data and make decisions, not only is HRV monitoring going to be positively contributive to ACL prevention, but it's also going to be a wonderful tool in the management of TBI.
Awesome, Don. Thank you. John, over to you. You're
Yeah.
using this data and from a slightly different perspective. You're using this in a concierge medicine program where you're working with executives and others more on the business world side of things. Can you comment a little bit on how you coach with HRV in that context?
Yeah, I mean, it applies similarly to that demographics. I mean, it applies basically to everybody. Before I answer that, I just had one question for Don on that subject. Do you ever use the HRV CV to kind of help guide you in terms of how you structure programs? Because I use that quite a bit with my patients.
Honestly, I I got spoiled when I was at Ohio State. I had 2 very high-end analytics groups that I was able to go to with my data sets, and they brought me back some wonderful insights. And I
Okay.
think that's a very valuable tool to have. we'll talk more about the fact that when we say HRV in this presentation, we're typically referring to a thing that's called RMSSD, the root mean square, which is vagal tone, and that's what we get out of most of our wearable devices. I like to dip in a little bit more. I tend to find a great deal of value in LF-HF ratios.
Yep.
Most of that's not available in most wearable tech. I have to bring in another technology on top of that. But John, I think we are still very early days on this, and I run correlations on everything. Um,
Okay.
so if I have a device that's producing some particular variable, I run the analysis. I personally have not seen the CV pop up to give me anything better than just straight up RMSSD, but I'm sure there's situations where it does.
Yeah, for those of us who can't really get to the root data, I think it may be helpful. So answering your question, Dave, this may answer some of the questions in the chat that I see in terms of medications. So obviously, I'm not working just with professional athletes. I'm working with old farts like myself. A lot of people come to me because they have, chronic illnesses and they're on medications. Sorry. And so my goal is to try to get them off medications, especially, antidepressants, stimulants, things like that. So I use the HRV quite a bit as I'm weaning people off medications, specifically things like benzos or blood pressure medications, because you can see quite a change in the way the HRV reacts to that. So I use that, as a good guide, but I use the HRV CV for my patients because it gives me a better kind of big picture of
Yep.
how they're responding to changes that we're making. And then, I use a lot of lifestyle changes. So getting light exposure, sauna, cold therapy. Some of my patients are, A-type and they're really pushing themselves a little bit too hard, or they're traveling internationally. In those instances, the HRV I think is very valuable because it tells you that, they're pushing it a little too hard. Have them back off. I know Don's, talking about never take a day off, but for my people, a lot of times I will tell them to maybe do an active recovery instead of really pushing it hard at the gym. Do a little bit of movement, get more light exposure, focus more on sleep and recovery, and then monitor and see how the HRV responds to that. But I think it's very beneficial, especially when you're talking about medications coming off of them or adjusting medications. It can give you insight into how they're responding to that.
Yeah, and we
Dr.
one quick
Limansky,
comment there, Don.
have you played around with cannabinoids and terpenoids when you're weaning them off of your benzos?
Yeah, somewhat. I would say probably more cannabinoids at this point. Generally, I'll just do a very, very long taper for most people, and then just kind of address whatever side effects that they're having from the weaning process. Uh, it depends on the state that they're in terms of, whether I can use some of them. But yeah, I find those to be beneficial.
Yeah, in our last webinar, we showed there's a case study on our website from a company called And Health. And Health is using HRV with autoimmune patients, and they're teaching patients how to read their own HRV and how to self-calibrate their own HRV. And what they're seeing is they can start to see when it's trending down for multiple days in a row, and it start to get to a certain level below their personal baseline. And that's where they become at risk for autoimmune flare, not unlike your Achilles example, Don, or
Mm-hmm.
your high performer traveler across the world. So I think part of this is also, as clinicians, teaching individuals how to self-calibrate and read the data themselves, and then how to engage in activities that are restorative and start to bring those numbers up to baseline. So
And,
we,
and
we
that
can link
goes
to the And Health paper as well.
Yeah, and that goes back to our earlier point. At the end of the day, at a medical on the medical side, we're trying to get patients to take ownership of their health, but they need
Yes.
objective data to make those decisions. And this is just a really good. I mean, the scale sucks. Blood pressure's average. This is a tool that you can use on a regular basis that really brings value.
Awesome. So it looks like you've got us queued up here, Don. You've really kind of set the stage on HRV as a biomarker, some of the research behind it. I think now it looks like you're going to shift gears into how do I actually do this on the daily if
Just
I'm
a little
working
bit.
with individuals and I want to implement this in practice today? What are the tools available to do this? So back to you.
So today's time constraints prevents us from doing a really deep dive down the rabbit hole of HRV analytics. If this is something you're looking for, this is an excellent review paper, an overview of heart rate variability metrics and norms. I recommend it highly. And again, the reference will be in the bibliography. But in this paper, the authors stress the importance of measurement context. And I can't emphasize that more, including recording period length, subject age, gender, on baseline levels. They caution that 24-hour short-term and ultra short-term normative values are not interchangeable. This is a really important point. They encourage professionals to supplement published norms with findings of their own in specialized populations. So just a great paper. I wanted to make sure and at least touch on that if you want to go ahead and dive in and just really geek out on this.
Yeah, and for those in the chat, there's lots of links that are being posted in the chat. There's lots of questions coming in. There's lots of citations in Don's paper. So we'll get all of this information cleaned up, including the questions, the answers, the links, and we'll send it all out along with the recording of the webinar. So don't worry if you're not able to see the slides or if you're not able to capture things from the chat. We'll get it all cleaned up and sent out after the fact.
So ECG is recognized as the gold standard for measuring HRV. That electrical signal is by far the best, capturing detailed variations in heart rhythms over time. This method provides comprehensive data that clinicians can use for accurate assessment of autonomic nervous system health. But moving back to our earlier vision of empowering our patients with their own health, limiting access to the assessment to your office or hospital is not realistic. Recently, there have been a flood of wearable devices that can effectively measure HRV. Recent advancements in wearable technology and mobile applications have made HRV monitoring accessible to a broader population. Devices like chest straps, mobile phones, smartwatches, and rings measure HRV in real time, providing instant feedback on health and performance metrics. Now, I think it's important to state that ensuring accuracy in HRV measurement involves using high quality ECG equipment or validated wearable devices that have been validated against ECG. There's a wide range of products on the market that do not have published validation papers. This is important. In my mind, this is a prerequisite for a recommendation, that you need to be able to have that paper to back up and say this product is the same as ECG. Not only the tool needs to be validated, but there needs to be a standardized protocol for data collection, such as timing, environment, or essential. These are all essential for reliable results. I personally like nighttime resting data. That's my favorite data. But if you're getting started, you want to figure this out, there's really good apps that you can get on your iPhone that use the camera on your iPhone, that there's good papers that have demonstrated this is an accurate measurement. So there's lots of ways to do this, but you got to figure out what your program is. For reliable HRV data, it's essential to consider factors such as the duration of the measurement, the time of day, and individual physiological states. Consistent conditions during monitoring can significantly affect the accuracy and the interpretation of the results. Comparing a nighttime resting HRV to an HRV first thing in the morning to an HRV in the middle of the day, this is not appropriate use of the data. Getting that systematic process in place is critical.
Don, it was not that long ago where we did not have these continuous passive sensors.
No.
It was not just a few years ago. You used to have to wake up in the morning, put the heart rate monitor on, get it paired to the app, sit still for 3 to 5 minutes when you're just trying to get out the door and get your day going, and you got 8,000 things going on. So you have an issue with compliance. You have an issue of all of the freight train of stuff coming at you in the morning. And now it's become a lot easier to capture this data. Now, if you're wearing a nocturnal device, it's not capturing a 3-minute reading in the morning. It's capturing the RR interval of every heartbeat while you're sleeping. So you're getting hours upon hours of measurements. So it becomes much easier to collect. And the technology continues to get better and more clinically accurate, which just removes the barriers to using HRV more ubiquitously.
So back in 2016, 17, and 18, we were using a chest strap device that went to a smartphone that measured HRV. It was by a company called Omega Wave. Getting my athletes to do that first thing in the morning was virtually impossible. Only my very high cognitive athletes. I had a kid on the team had transferred in from Stanford. He was wonderful. This kid, he had a perfect score on his ACTs. Really smart kid. He bought into it lock, stock, and barrel. The rest of the team, I had to measure right before practice, but I had consistent right before practice measurements every day.
Got it.
And I always qualified this. Are these athletes ready for the training load I'm getting ready to drop on them in practice?
Sure.
That's how
Yep.
we would interpret that. But then when I was with the team, we were traveling on the road and I had a level of control. I would get those measurements first thing in the morning after they woke up. I would go room to room, do all the measurements. And again, so how you now I would never combine my pre-practice measures with my morning measures. I only made evaluations on my morning measure data and I only made evaluations on my pre-practice data. And again, to put it in perspective, Aura released, I think, version 1 in 2017, I think it was. I think I had one back then.
Yep.
We put it in the budget to get Aura rings back then. They never got them approved before I left. And I don't think they started using Aura rings until they're into late version 2, 3, but still, they're still not going well. Okay, so I've used the term photoplasmography. PPG is an optical technique used to measure the changes in blood volume in the microvascular beds of tissues. It works by shining laser lights through the skin and detecting changes in that light that pass through and is reflected, which are correlated with blood flow. This technique is commonly used to assess various physiological parameters like oxygen saturation, heart rate, blood pressure, and more. Multiple authors have demonstrated the use of PPG can be an effective tool for the assessment of HR and HRV. So multiple papers out there backing up the use of PPG. HRV can be measured through various methods that capture heart rate data accurately, providing insights into health and stress levels. These methods include what we call time domain and frequency domain metrics, as well as nonlinear metrics, each offering different unique perspectives on HRV. Now, we only do a limited review of this. This could be a 3-hour webinar in and of itself. Now, most of the time when you have a wearable device that says HRV, it is probably reporting what's called RMSSD, the root mean square of successive differences. This is typically referred to as your parasympathetic response. It's very parasympathetic dominant, while it still has sympathetic capabilities in it. The standard deviation of those is called SDNN. It's a more true combination of the two. There's other time domain metrics, but again, when you have a device like an Oura Ring or something like that that's measuring HRV, it's usually reporting RMSSD. I believe there is huge value to come in the frequency domain analysis. Frequency analysis and heart rate variability measurement involves decomposing the heart rate signal into frequency components to assess autonomic nervous system activity. Low frequency reflects both sympathetic and parasympathetic activity, but is often interpreted indicative of sympathetic modulation. High frequency is typically associated with parasympathetic or vagal activity, and has wonderful respiratory influences on heart rate. There's what's called a VLF, very low frequency. But looking at what we call autonomic balance, this is one of my favorite tools. LFHF, looking at that balance between sympathetic and parasympathetic balance. Most wearable devices do not have this analysis in their software. So I've usually got to bring in another system to measure this, but I'll bring that system in when I have an athlete or a person I'm struggling with, and I want to do an analysis. Is this a lack of parasympathetic, or is this an excess of sympathetic? How do I start to work with this patient? And this
Got
is
it. That makes
one of
sense.
the analysis that we use.
Yeah, there was a question in the chat, Don, that you don't get a lot of this LFHF just from the standard off-the-shelf wearables, and you made that point. Can you comment on some of the other equipment you'd use to get that information?
Yeah, I'm a huge fan of the team out at HeartMath. They have a great little tool that you can use. And if you're a professional, they have a professional data set. So they have entry level devices you use that measure coherence and coach you through improvement of this. But if you want to do the analysis, you got to kind of go into their professional data setup. That's usually what I use for this. There's multiple tools out there, but my preferred, the thing I use is the stuff from the HeartMath team.
Yeah, thanks. And we're getting a lot of questions in the chat. Does Heads Up integrate with HeartMath? We don't today. We've had a ton of requests, and we'll get it on the roadmap. So in progress.
I'll be excited when that happens.
We got you, Don.
So, normative data. Normative HRV values vary by population, age, health status. Generally, higher HRV reflects better cardiovascular fitness, while lower values are associated with stress and various health issues, highlighting the need for individual benchmarks. My experience is that when a client has HRV values that are far below normal, I begin to suspect the impact of trauma. This is something that I have found over time, that when you're dealing with a patient or an app, I have this in my athletes. I have an athlete. I make observations based on the family situation, things like that. There's obviously trauma going on here, and trauma will dramatically drive down your RMSSD scores because it drives up your sympathetic response. You become hypervigilant. That's what's going on there. So as you're working on this, you wind up developing your own data sets. Do I think most Americans need an RMSSD of greater than 75 milliseconds in order to thrive? No, I think most of us thrive way below that. But if you're an athlete that wants to make All-American or win a national title, you got to go into the tournament with a bunch of resilience. That's your ability to get through the tournament. In your weight class, you got another 32 guys that are highly skilled, well conditioned, that belong there. The ability to move past them and win the 5 matches that you need to win a title or to become an All-American, it's resilience that determines that. So developing your own norms winds up being important. Monitoring HRV can result in trends in health, stress, recovery status. Again, low HRV is linked to chronic stress, fatigue, and potential cardiovascular issues, emphasizing the importance of proactive health management. Now, I'm going to go through a series of slides about integrating a tool into your practice, and we're going to focus on the Heads Up Health platform because I think it's an excellent platform for this. There are multiple quality devices and apps available on the market. Everything that I've put on the screen here shows they have data comparing their device to wired EKG. Okay, this is really important. That's why I include this. One of my favorite tools right now is the Oura Ring. The reason I like the Oura Ring is that I have such high usage. I get good data, and again, it's greasy slick to get someone to use it. I just need them to wear it. I don't need them to do much else than that. You know, they download it every morning, but this is why I like this tool so much. I like the finger over the wrist. Now there are good wrist-based devices out there. I don't want to take away from that. There's also some real shitty wrist-based devices out there. I'll warn you. I just really like the Oura, and again, their data that they have agrees very well with ECG, and they have good papers to back this up. Now, when I'm using my Oura Ring, I wind up with a series of screens on my smartphone that look like this. As a practitioner, the screen on my client or my patient's smartphone doesn't do me any good. I can't, I'm already in a situation where my patient walks into my room. I'm overwhelmed with the number of people I have to see. I don't have time to go through this, but it provides good, high quality data. But to review it when it's on your patient's finger and the data on their phone is very difficult. This is where something like the Heads Up Health platform comes into play. In this case, we're looking at data for the day, for the week. We can look at readiness. Well, I can see that same data when I link that patient's account to my Heads Up Health account. I see the exact same thing that's showing up on their phone. I see the same data as it relates to readiness, oxygen saturation, time of sleep, HRV, all those critical factors, and it runs automatically. Now, the value prop then starts to come in. Again, the HRV data on the phone, I can look at it over a week, over a month, over a year. Well, I have the same ability to go into my Heads Up Health account and see it for the week. But I think the real value prop comes into play when we start to use Heads Up Health reports. This is looking at my activity score coming out of my Aura Ring over a period of 6 months. Now, not a bad graph, but one of the things I like about the Heads Up platform is that they have a data smoothing capability that I can go apply a best fit line where all of a sudden the jaggedies get a lot smoother and I'm able to make better decisions. Now, then with a series of slides, this is looking at activity. If I take this activity and move to the next level, I can take a look. This is my HRV for a similar time frame. When I overlay my HRV and my activity, you'll notice for me out here at the end of January to the end of February, beginning of March, I have a great movement in my activity score, and I have a corresponding response with my HRV. So now, mind you, it's important to put this in context because we're going to look at the end of this graph and see something different. At this time, for those of you that don't know me, I live a nomadic lifestyle. My wife and I live in an RV and we travel full time. We've done this for 3 years. That period of time from from December all the way through the end of February, we were up in Lake Tahoe, California. My absolute happy place. Okay.
Mine too,
I
by the way, Don. I used to
I
live in
feel
Truckee.
I'm telling you what, I don't feel any better anywhere I've been in the country than when we're up there. So I'm getting a pretty cool combination. Does my body like a little bit of altitude for that period of time when I'm doing the work? I got 7,000 feet of altitude under my feet. Is this contributing? Because what you'll see at the beginning of March, we drove back east. I've seen not quite the corresponding work level. If you look at it right now, I'm getting really close, but I see an increase in resistance or in an increase in activity, but you see a drop in HRV. Well, at the same time, listen, I've had life kick in. I've had issues with my life that I've been working with. And frankly, I've been under a lot of stress February and March. And we're seeing the contribution of this to the overall. So I can see my activity score go up, but I don't have the corresponding response in my HRV score. Well, this is the impact of stress, and it explains a lot. Now, if we take this one more step and I turn on nighttime resting heart rate, this man, you don't know how geeked up I was back in February when I see activity go up, HRV go up, and nighttime resting heart rate go down. That's improved VO2. Nighttime resting
Yep.
heart rate, as that drops, that's improved VO2. Now we
Yep.
start traveling back, and I'm still getting some nice nighttime resting heart rates. I believe as we went into April here, I had a little bit of a sickness. So we get a little bit of a response there. But you can't make these decisions using the traditional um, Omega Wave software. I have to have a platform like this that I can go in and make these decisions. And as we improve the software, as we improve this system, we're going to start to be able to make better calls. And again, once we have things like AI running on top of it, I think we have a really interesting time coming in medicine for us.
We're getting
So,
there, Don. But that
so
curve, if you can just go back one, that area where you saw training load increase, resting heart rate go down, HRV go up, and those are really when you can see that everything's working the way you would hope it to work. When all three of those move in that very predictable pattern, that looks like a great physiological response.
That was
And
a
then,
good
as you
place for
mentioned,
me.
later in the year, you don't see the same pattern. And then, as clinicians, we need to do a little detective work to figure out, what is continuing to keep the resilience of this individual lower than it would be expected. And that's where, like you said, life kicks in, other external stressors kick in. So you can see that clear as day on there.
Yeah, I had a knee surgery 4 years ago that I got a MRSA infection from, and I was very ill for 60 days. And it's taken me close to 2 years to really crack getting back to where I was the week before I had that surgery. So, the impact of these infections, the impacts of these life stresses, that they can go on for a long time. Um, but you're only able to see this when we're really starting to look at the data over a long period of time. So, okay, we've gone much longer than I expected to go. I apologize. It's Dave's fault for asking so many questions. But our objectives today were to make a case for a universal health and performance marker. I believe HRV is that 30,000-foot view at all things health and performance. Now, we
I
can
agree,
come.
Don. I said that right at the beginning. That's why we wanted to do this webinar. I could not agree more on bullet point number one.
We've reviewed how HRV is reflective of that autonomic function. It's informed by that, and the role of the role of the autonomic system. The more we understand that, the more we're going to understand disease and performance. That's critical, I think. I think we've presented enough data to support that we can measure HRV using photoplasmography tools, or if we have EKG tools, great. But we can use photoplasmography in wearable devices to effectively measure and manage our lifestyles. And then finally, we've talked about integrated into your practice. This is where I think the Heads Up Health platform is an excellent tool for this. It's the next step up. And I think their ability to integrate other data into this, labs, so forth, is wonderful. So, with that said, thank you for your time. Let's take some questions. If you want to get a hold of me, I'm Don Moxley at trainrecoverwin.com. You can go to my website, Train Recover Win, and I'll tell you, we've started a podcast, not two podcasts. One's called the 90% Healthy Podcast, and the other one's called Life Over the Horizon Podcast, which is on YouTube.
Awesome, Don. If you want to stop the share, I'll fire mine up again. And we've got a few little closing things here to switch gears towards. There were a few questions in the chat. They came in related to HRV and perimenopause. That happens to be the June webinar. So a lot of the questions were predictive of what we're going to present on next. So I think it's June 16th. We'll have some very talented educators speaking on how to use HRV as a biomarker in perimenopause, among other biomarkers. So that one's coming up next. But if there's other topics you want us to hit, let us know. I'm going to leave this up here for a second while we switch gears. And let's take a few more questions here. I had flagged a few as we were going through the chat. So can Raynaud's affect HRV? And I have a family member dealing with that. I think, if anything, first of all, John, it might affect the ability to even capture HRV, especially on the finger. But anything specific to Raynaud's you want to comment on?
I mean, yeah, two things. So depending on the device, if you're using a strap, it shouldn't impact it. Obviously, if you're using the Oura Ring, it theoretically could. Again, Raynaud's usually is going to be more distal to where the ring is, but depending on the severity, it could. One of the treatments for Raynaud's are calcium channel blockers. So if you're on those, obviously that would impact the HRV. So I think it depends on the device and then the severity of it.
Great. Thank you, John. Can HRV be used to help control anxiety and panic attacks? I think, well, first of all, knowing how to monitor one's HRV can help one anticipate when you might start to be moving towards a state where you're at a higher risk for anxiety or panic attacks. So I think that's where educating on how to read your own biomarkers and self-calibrate towards that number can be helpful. It can also be anxiety producing in and of itself just by looking at the number. So it's a little bit of a slippery
Well,
slope there. Anything you guys would comment on?
remember, HRV is the speedometer on your human dashboard. Okay. When you hit the accelerator, that's sympathetic. When you hit the brake, that's parasympathetic. there are behaviors in your life that are the equivalent of stepping on the gas or stepping on the brake. So, and HRV will reflect that. If it's working, HRV will reflect that. So I see it as a feedback tool, not necessarily, this is correlational, not causative. That when I'm struggling with an autonomic dysfunction of some kind, I'm going to have low HRV. Then I need to change my behaviors. It's the trigger. You're looking at the speedometer. You only look at your speedometer when there's flashing blue lights in the back window, right? So it's going to give you the flashing blue lights. That's going to cause you to say, "Hey, let's step on the brake and get control of what I'm doing."
Thank you, Don. Question on how can HRV help differentiate between mental fatigue, physical overtraining, and other stressors? I think HRV can be the indicator that there's something to pay attention to, and then that's where some of the detective work comes in from the clinical side of things. But I'll open it up
And
to
I
you guys
wouldn't
there.
and I wouldn't differentiate. Descartes was wrong. There's not a mind-body duality. They are completely linked. You have to recognize that the thing I do with my body is going to affect my mind. The things I do with my mind are going to affect my body. Again, it's the accelerator and the brake, with the HRV being the speedometer. Okay, so this is going to tell you, do I have the resources necessary to make the move I want to do? So I wouldn't separate the two.
Dr. Navaz made a comment on the last webinar that struck me is also, how does this relate to one's innate feeling of safety in the environment that they are in at that exact moment in time? So creating the conditions where you feel that you are able to relax, to unwind, to allow for rest, to feel physically safe, mentally safe, spiritually safe. So it was interesting for him to connect it back to that word safety in our life. And that can mean many different things, but that was just a helpful way to think about some of the different ways that our environment that we're in at that moment in time can play into HRV.
And I think it's important. I use the analogy many times that if I'm born into a rattlesnake pit, the only way I survive that is being hyper vigilant. Okay, so if I'm born into a situation where it's very traumatic, very stressful, it's going to have an effect on my autonomic system. And even if I move out of the rattlesnake pit into a house full of bunny rabbits, while I still not have threat, I'm still going to be hyper vigilant. So it's that vigilance in the safety that we have to learn to deal with on a stress level. This is where polyvagal theory comes into play. I really recommend understanding that if you want to make it part of your practice. But that safety space is critical. But creating the atmosphere in your body, creating the relationship in your body so that you actually can achieve that, there's good tools. And I saw a question in the questions asking about heart math and what do they relate to HRV. Well, heart math actually measures. It's an HRV based biofeedback tool. So using breathing techniques and using, which are very powerful parasympathetic drivers. But heart math gives you a tool for parasympathetic coaching biofeedback tools. So, but it also, their professional tools can actually measure HRV with LFHF.
Awesome. Thanks, Don. Okay, fantastic. And then if you want to get a demo set up on how to start monitoring HRV in practice today, you can hit that URL or you can scan the QR code. We'll show you everything that Don showed you today. How do you get patients instrumented? How do you get the data flowing? So if this is something that you want to start dabbling with, or you've got a practice you want to start rolling this out today, let us know. This is where we specialize. This is what Heads Up was meant to do. Heads Up was meant to be that interface into these biomarkers that help you understand individuals in real time between the visits and find the opportunities to make improvements in behavior modification, treatment plans, medications, optimization strategies. So we'd be happy to show it to you in more detail. Our next webinar coming up on June 16th will be the Women's Health Masterclass. This will be the first in a series of webinars diving into women's health, perimenopause. How do we start to monitor this data in real time? There's incredible new tools on the market that can start to give us real-time insights into these types of protocols and optimizations. So we'll have Dr. Kayla on the next webinar on June 16th. You can register for that at headsuphealth.com/training. Katrine Valinsky will also be on there. We'll be talking about HRV, continuous glucose monitors, this new device called Mira, which can provide some at-home hormone testing, other types of diagnostics that we can use to really dial in these types of conditions in real time. So we're really, really excited to start branching out into those topics. And for those who gave us suggestions on other webinars, thank you. We'll get those reviewed, get them in the queue. The slides and the recording link will be cleaned up here. We should be able to get that out to you on Monday. We did have a lot of questions on this one, so we're going to try to get all the questions typed up as well with responses, and then all the links from the slides that Don shared, and then all the people in the chat who were sharing helpful links as well. We'll get everything cleaned up and get it out to everyone early next week. So with that said, thank you everyone for taking time out of your day to attend the webinar. Hopefully we gave you some good insights that you can start to apply in the day-to-day. Big shout out, big gratitude to Don. Thank you, Don. That was fantastic.
Yeah,
And to
Thanks
Dr.
so much.
Limansky and to Aaron and my awesome team here at Heads Up for making this possible. Thank you, everyone. Have a wonderful day.
So Heads Up is a data platform that connects an individual patient and a practitioner provider, and it creates a common space where healthcare can be accurately tracked, measured, and optimized. So how do we do that? Let's take a walk through the system. So the first step is getting users in the system through the Manage Users function. You can import CSV files, and if you have an existing practice management or electronic health record system, we can actually integrate into your existing systems and create what's called a single sign-on connection. And the first thing we do for each client is we give them the concept of their own personal health dashboard. And the dashboard is going to contain the metrics that you need them to pay attention to as part of the journey. So the first thing we do is we allow the ability to capture data from clients remotely. And the way we do this is we connect to the latest cutting-edge sensors and wearables on the market. And what these are doing is they're passively collecting data in real time, sending it into the system so that we can use that for day-to-day, what I like to call micro calibrations. These are the lifestyle changes we can make. So you can see here, we integrate all of the top FDA-approved medical devices, and we will customize these dashboards based on your exact programs and protocols. So the next section we want to review is lab results, and Heads Up is able to take in diagnostic lab data from any source. You can see that we pull in traditional blood work here. We can also pull in data from DEXA scans, in-body scans, urine and microbiome, heavy metals, stool, and we can start to see and track these lab results over time. The next thing we want to look at is what we call progress reports. And progress reports, that's what's going to let us look at an individual's health over the last month, over the last quarter. You can see here, it looks like this day we hit 208. So that's a day I'm going to want to double click into. And I may want to ask the individual, was there a specific meal that you ate on this day? And if I can say to a person, instead of eating a cup of rice, why don't you try a quarter cup of rice? And we start to see how we can make these small changes now that are going to have long-term benefit on preserving the health of the system. You can see we're capturing a lot of different information, and when we work with a clinic or an organization, we'll build each portal to help you capture exactly what you need. So we custom build each instance of Heads Up exactly to your program and exactly to your protocol. So that's what each individual will experience. Now what we want to do is start to say, okay, I've got this data now coming in from dozens, hundreds, thousands of clients. How do I start to analyze this information at scale? First is we want the ability to identify outliers. So the first thing we want to do is have the ability to come in here and set notifications to only flag the things that we're interested in. So that's where we can start to take all this data in and really just look for very specific signals that you care about, that you want to engage in. This is going to save you a lot of time, and it's going to help you identify only the instances where you need to engage. So that's alerts and reminders. When we work with your organization, we'll build out all the intake forms and assessments that you need. They can be quickly assigned, and we'll show you how this data comes in. Each of the answers to these questions is also stored in the database. Templates allow us to create content that we want to create once and share many. This is the HIPAA-compliant messaging, as I mentioned, so we can do secure messaging to each client bidirectionally, all encrypted, all stored in the database, all very secure, accessible to clients on the go through the mobile app or through the web browser. So here is where we can start to build any kind of report on top of the data that you want of my entire cohort of people. Very simple queries we can do on top of the data to answer questions quickly. So we launched the concierge service, and this is the simplest way for us to help you structure otherwise fragmented data. All you do is click on concierge, browse onto your computer hard drive. Let's say this is blood work for an individual client. All we need to know is who does the PDF file belong to, and you can upload multiple. We will take it from PDF, structure the data, and put it back on the trend line with all of the other tests that represent the same value. That's how we start to holistically bring fragmented data together. We just need to know, what is it that you're trying to measure? How do you want to define success for your program? And then we'll build an instance of Heads Up exactly to your business and get you the exact outcomes you need. That's Heads Up. That's how we make health measurable. Thank you.